Inspectors were at the hospital for 3 days and didn't like what they found. Routine operations cancelled, medical equipment dirty and untested, 112 cancer patients who had waited more than 100 days for treatment. Dr. Angela Tillett is Colchester Hospital's medical director.
Obviously, it's very concerning and disappointing. I think we recognise, and the CQC certainly recognise, that our staff have been working very hard, but undoubtedly the CQC noticed that we were not providing consistently good care all the time to all our patients.
The failings go back years. The Health Trust's been in special measures since 2013. There have been police investigations here amid unproven claims staff were bullied into altering cancer patients' records. Professor Sir Mike Richards, the Chief Inspector of Hospitals, said, "Once again we have found a number of serious problems when we inspected the services. I am concerned that the Trust has not taken sufficient action to address the requirements of our previous inspections." To add to the worries, the hospital was described as losing its grip on the thousands of outpatients waiting for appointments. Barbara Stuttle is the Director of Nursing. The CQC said a shortage of registered nurses meant the hospital relied on agency staff, and some weren't up to scratch.
Unfortunately, not all nurses may work to the standard that you would wish. Where we have had difficulties, we've addressed that, and we've either asked the agency to terminate that nurse working with us.
This patient told me he was happy with his care. 80-year-old Peter Smith was recovering from a leg operation.
They have been really good. The staff are friendly, helpful, they all put themselves out.
The CQC criticised the Trust's ever-changing leadership, describing a disconnect between managers and frontline staff. But Frank Sims, the Chief Executive, said there's now a permanent management team in place, determined to improve standards. Frank Sims, the Health Trust's Chief Executive, told Look East there's a permanent management team in place, determined to improve standards.